Groin pain can be quite annoying. I get it. It can be classified as a number of things according to the Doha Agreement. Specifically, we'll focus on the adductors and hip flexors, which are common muscles for overuse injuries. Unlike acute strains, these complaints tend to get worse at the start of activity, improve with warm-up, but worsen the next day or after exercise. Estimated recovery is around 4 to 12 weeks, depending on the severity of your injury. Your injury may have a number of causes, but the main one is likely to be overloading. This rehabilitation aims to reduce the load placed on your body and gradually restore and increase your capacity. First step is to reduce the pain by minimizing activities that provokes your pain. You want to adjust the frequency, intensity and volume to a manageable level. For example, if you're currently playing paddle tennis 2 to 3 times per week, consider reducing this to once a week or not at all. Eventually, to maintain some strength and reduce pain, you will want to start gradually with static or isometric exercises for the groin. As the pain decreases, you can gradually introduce more challenging strength exercises to increase groin muscle tolerance and capacity. Research suggests that strengthening the hip flexors and adductors can effectively treat groin pain. The first two categories focus on the hip flexors and adductors through different range of motion. Difficulty of the exercise increases as you progress. The last two categories emphasize the abdominals and abductors, which also increases levels of difficulty. Once you feel comfortable, you can gradually introduce compound movements that work several muscle groups at once to strengthen most of the hip muscles. Research also showed that gradually getting back to running straight, sideways and eventually sprinting with minimal pain is important for returning to play. Plyometrics are also recommended in this phase to build rhythm, timing and coordination. You want to have no pain in dynamic warm-up, strengthening exercises, running, sprinting, twisting or turning. No pain when palpating and squeezing the adductors. To summarize for you lovely people, phase 1 is reducing provocative activities and isometric exercises. Phase 2 is gradually introducing more challenging strengthening exercises to build strength and capacity. The final phase is return to running and plyometrics. And here is an example of training week in the early phases, and here is an example of a training week in the late phases.